Let's take a deep dive into the pathophysiology of pancreatitis, a condition that transforms one of the body's most vital digestive organs into a site of intense inflammation and destruction. To truly understand this, picture the pancreas as a powerful factory that produces enzymes to digest food and hormones to regulate blood sugar. Under normal circumstances, these enzymes are secreted in an inactive form and only get activated once they reach the small intestine. But in pancreatitis, something goes wrong within this finely tuned system, leading to a dangerous process of autodigestion where the pancreas begins to digest itself. The two most common culprits are gallstones and chronic alcohol use. Alcohol, on the other hand, stimulates excess enzyme production and thickens pancreatic secretions, causing obstruction at the ductal level. Whether from gallstones, alcohol, trauma, or drugs, the end result is the same: pancreatic duct obstruction or acinar cell injury. The inflammatory response doesn't stay local for long. As capillaries become more permeable, fluid leaks into the interstitial spaces, causing massive edema and hypovolemia. This leads to third spacing, where fluid shifts out of circulation into surrounding tissues, explaining why many patients present with low blood pressure, tachycardia, and dehydration. As inflammation continues, enzymes and toxins enter the bloodstream, triggering a systemic inflammatory response syndrome (SIRS). If this response becomes uncontrolled, it can cause multi-organ failure, especially in the kidneys, lungs, and cardiovascular system. I for injury to acinar cells, T for trypsin activation, A for autodigestion, P for perivascular inflammation. This mnemonic summarizes how a local pancreatic injury spirals into a potentially fatal systemic condition. However, in severe or necrotizing pancreatitis, extensive necrosis and infection occur, often leading to pancreatic abscesses or pseudocysts. These cysts can rupture, causing internal bleeding or infection. Nothing by mouth status in acute cases to reduce pancreatic stimulation and giving for fluids aggressively to counteract third spacing and maintain perfusion. In summary, The pathophysiology of pancreatitis revolves around a single destructive principle: the pancreas turning against itself. What begins as an obstruction or injury escalates into a self-digestive, inflammatory, and systemic catastrophe. Understanding this cascade helps clinicians predict complications early and implement life-saving interventions before irreversible damage occurs.